we started working on this through the Vanderbilt TSU Cancer Partnership, so our focus was already on cancer in general. And as we looked at some of the health disparities in cancer, one of the issues, big issues that came up is cervical cancer. It affects both African American women and Hispanic women disproportionately, higher rates of cervical cancer incidence in both. There are some Tennessee and Davidson County rates on your figure as well, but there were no data for Hispanic women at the state and county level. We started this in 2007. There were basically no health data on Hispanics at all for the county. So we set out to do a needs assessment. We did a survey, Hispanic Health in Nashville survey, and just a highlight of a couple of the findings we found to sort of describe that community that we were working with. Low levels of education. This community is a very high portion of recent immigrants from Latin American countries, which is different from, say, California, Florida, New York, where there's traditional, long history of immigrant generations. In those communities, we have a very new immigrant community here, so about 2/3 have less than a high school degree. This was out of a sample of 500 adults. It was not a random sample, but it was fairly representative of geographically of where the Hispanic population is distributed in the community, and also national origin. Over half speak little to no English, so language barriers was definitely an issue that we needed to be aware of as we move forward. Use of Spanish language media was very high, radio being the highest, and if we combine all three, so I think 95% of the respondents used at least one of these Spanish language media. So that was one thing that directed us in our planning. That's just some examples of some of the information that we gathered about the community as we were planning. Next, you select your target behavior in the initial planning phase. As I said, in social marketing, you have very specific behaviors that you want to focus on. Some more results from our survey. We asked, what are your top 5 health concerns for yourself or your family? These are how they broke out. Cancer was number 1. That was pretty surprising to us, actually. But it made sense when we talked to people. They said about 80% of the adults were uninsured. 4 out of 5 were uninsured. So children is a little bit higher because native-born, U.S.-born children can qualify for TennCare if they're low income, but adults cannot if they're not legal residents, legal permanent residents of the United States. So health insurance coverage was a big issue. So they were concerned about high-cost chronic conditions. If I'm uninsured and I get a very long-term expensive chronic disease, that's a big concern to people. Also, work accidents were high, big proportion of the male population working in the construction industry. So that was a big concern. Also, diabetes and obesity with that was high. Dental care, lack of insurance, but also in the whole community, a lot of us don't have dental insurance. And also drugs, uninsured, access to care for uninsured was very high. So these are some of those top issues, or some of the issues that we've been working on. But for this example, I'll move forward about cancer. So we started thinking about, thinking about cervical cancer and the HPV vaccine. This was 2007, the HPV vaccine had just come out in 2006. And we asked about it in the survey, I'll ask you in a minute, but one concern we had was when there's a theory called diffusion of innovation theory, and that says that when new things come out, whether it's a new iPod or whether it's a new type of screening for mammography or any kind of new innovation, there's sort of a cycle of how people adopt that new innovation, that new technology or that new thing. So the people who line up at the store the day before the new iPads come out, those are the innovators. Those are the people who are running out to try something new whenever it comes out. Then the early adopters are like, well, I'll wait till the crowds go down. I'll get one soon, but I'm not going to be standing in line. They might be the early adopters. Early majority is like, well, I'll wait till as they work out the kinks, and then I'm going to get it, but I'm going to wait a little bit and see how things go. Late majority is like, well, after it, most everyone has one, and the prices start going down. Well, then I might go, and they're on sale, and and the laggards are like, never getting a smartphone, So you think about that in terms of technology, but it also applies in any kind of innovation, any kind of new thing that comes out. And this was actually developed in the context of agriculture, and new technologies for farming is how they developed this model. But when we think about it for health applications, we were worried about HPV vaccine coming out because how it could affect disparities, because one thing that's been found in any kind of application, any kind of new technology or new innovation, is that more advantaged groups, higher income, higher education, more socially advantaged groups tend to be the early innovators and adopters, right? And the more disadvantaged groups, whether it's income or racial and ethnic minorities, tend to adopt things more slowly. So if there's a new innovation that can help prevent cervical cancer, and the already advantaged group adopts it faster and the disadvantaged group adopts it more slowly, then disparities can widen, disparities can get worse. We've seen that Dr. Levine at Meharry has done some research on that with the heart treatment for HIV. Disparities widened after that came out. When Medicare started covering mammography, disparities widened at first. So that happens when new innovations come out. So we were concerned that the HPV vaccine being new, we need to make sure that we need to speed up that process of adoption in the disproportionately affected communities, which are African American and Hispanic women in this case, to help reduce disparities. So we asked about it in the Hispanic Health Survey. Sorry, some weird characters come up when we transferred it from the MAC. But we said there's this new vaccine. If you have a daughter 18 or 9 to 18, would you be interested in getting this new vaccine that prevents cervical cancer if it were free? 92% said yes, definitely or probably yes. We were just astounded that it was such a positive response. But when we talked to people a little bit more, it started to make sense. People were like, we always get vaccines, we always get shots. In our country, if you go to the doctor and you have a strep throat or any kind of infection, you get your antibiotics in the shot. You get everything through an injection, very commonly in Latin America. So there was, in general, very positive attitude about immunizations in general and shots in general. So there wasn't really, that was a big opportunity that we saw there. And then here's some recent data. These were not available when we were planning our first project. There was no data available yet on HPV vaccine use, but now some recent data that have come out show that the first section is getting there are 3 shots in the series for HPV vaccine. You have to get 3 shots over about 6 months. So in terms of starting the shot series, getting 1 shot, Hispanics are higher. They're more likely to go out and get the first shot. Getting at least 3 shots, and this is from the National Immunization Survey for Teens. So it's a one-time survey. They ask them sort of retrospectively how many shots have they gotten. So some of them may not have had 6 months yet to get all 3 shots. But if you just look at getting 3 shots, there's not a difference. But if you look at has there been at least 6 months to get the 3 shots, that's in the final section. If it's been at least 6 months since the first shot, how many have gotten all 3 shots? The African American and Hispanic rates are lower. So even though Hispanics are more likely to go out and get it, they're less likely to complete it. And African American girls are also less likely to complete the 3-shot series. It's ineffective if they don't get all 3. So it's the same as not getting it. So that is one reason why we wanted to extend this work to African American girls as well. So selecting target behavior, this is one approach that they suggest, is looking at your return on investment. You might have several different types of behavior you could choose from. Say if you want to promote preventing weight gain, say that's your goal. You've got lots of things you can do to promote preventing weight gain, right? You can say, well, let's say you want to drink less sodas. We want you to eat more fruits and vegetables. We want you to exercise more. So all sorts of things, behaviors you can choose from that all can contribute to your overall goal. But in your marketing process, you need to focus on one behavior at a time. You may end up selecting 1, 2, or 3 behaviors, but you may have different strategies for each one. So we were concerned about cervical cancer disparities, and we said, well, we can focus on Pap screening. We know that that is effective in reducing cervical cancer mortality. That's very effective. So if we look at the impact, we know it has a high impact, very high impact, if people can go out there and do it and get followed up as needed. But how likely are we to get people to make a change beyond what they're already doing? So already women have fairly decent rates of cervical cancer screening. There are groups who don't get as regular screening as they should. There are those who don't follow up when they have abnormal screening. So there are definitely improvements that need to be made, but we felt like there was a bigger likelihood of making a change in behavior if we focus on vaccine, because this is something new that people have not done. most people have not done yet. And we saw in our survey that parents were very receptive to the vaccine. So we felt there was a very high likelihood of, if we focus on behavior, being adopted. And we know it has a high impact. We didn't put it as high as the Pap screening because the vaccine only prevents 70% of cervical cancers. It doesn't prevent 100%. So it's not as high in terms of impact, but if you see the convergence of those two lines, and this is just our conceptual thinking about this, is not a quantitative real data, this is just our thinking of the concepts, but if you converge the two lines, it sort of balances out high or medium-high impact and high or medium-high likelihood of adoption. That corner up in the top is where you have the biggest impact. That's where you want to be, out with a fairly good likelihood of adoption and a fairly good impact. That balances both, and where you get your best return on investment, the biggest bang for your buck, basically. So that's what we thought about for Hispanic girls, and then when we started looking at the same issue for African American girls, we didn't have any data showing such high receptivity to the vaccine among parents as we did for Hispanics. So we felt like, and there were some indications in some studies that have been done that there's a little bit more resistance perhaps in the African American community, and some healthcare providers were telling us as well. Some parents are a little skeptical. So it felt like it might be a little bit less likelihood of adoption. And if less adopted, it could have a little bit lower impact. And also, because of the lower rates of starting the vaccine, we saw that not as many girls are starting the vaccine. So it may have a little bit less impact, but it still could have a big impact. So that's why we focus on the vaccine rather than Pap screening. And also some other projects we're working on at Meharry are focusing on Pap screening. So this was a good opportunity to work on that. So some other things you do in an initial planning phase: preparing a background statement. I'll give you an example of that. Conducting a situation analysis, selecting your priority populations, and looking at gaps in information. So that in our next step, formative research, where we do some background research, some audience research, you collect additional information. So we'll go over these a little bit. In a background statement, you basically sort of lay out what your initial thoughts are about the issue you're going to focus on. So our background here that we want to state is the new HPV vaccines that are available, are now 2 available, prevent 70% of cervical cancer cases. Widespread use could substantially reduce cervical cancer disparities, and by targeting African American girls and Hispanic girls, this was the example of the new project, could help reduce these disparities. So our purpose, our long-term goal, is to reduce cervical cancer mortality and disparities. But in terms of our behavior, we were focusing on increasing use of the vaccine among African American girls ages 11 to 18. That's the age range. The vaccine is available, approved from age 9, but CDC sort of starts promoting at age 11 because that's when teenagers have to go get their adolescent checkups and other vaccines as well. And it's free up to age 18, so we were focusing on age 11 and 18. And we did the same with the Hispanic project. Then you may have done in your organizations a SWOT analysis: strengths, weaknesses, opportunities, threats. So we do this as well. We went through this with our community advisory board last meeting, and we had some initial thoughts and we expanded on these. So strengths, this just helps us sort of, as you're getting started, to lay out your thoughts and think about what you need to consider as you're moving forward. So if we look at our internal strengths, internal to the collaboration, the coalition, whatever partnership is working together, we reflected and we said, well, on our community advisory board, we have a lot of different organizations represented that bring some strengths to the partnership. And we have some resources available through the Outreach Corps, through the Cancer Partnership that we can use, and also partner organizations have many resources that they may be able to contribute. We had our experience from our previous pilot project that we had done, some pilot funding from the Cancer Partnership, and also working with Carol Bryant as a consultant, we felt was a strength for our project.